Let us learn some anatomy of the humerus for Viva examinations. First, we have to determine the side whether it is right or left. This is right side humerus. The upper end consists of the head, anatomical and surgical neck, and the tubercles. Then we have to describe the basic appearance. It has two ends, upper and lower, and a shaft. The head is hemispherical in shape and articulates with the glenoid fossa of the scapula. The head is much larger than the glenoid fossa. Just below the articular surface of the humeral head, there is an oblique narrowing encircling the head, and that is the anatomical neck. There are two tubercles in the proximal part of the humerus. The greater tubercle is the most lateral part of the proximal humerus and contains three facets: superior, middle, and inferior. For the attachment of rotator cuff tendons, that is supraspinatus, infraspinatus, and teres minor from above downwards. The lesser tubercle is anterior to the anatomical neck and gives attachment to the subscapularis tendon. In between the tubercles is the intertubercular sulcus or bicipital groove. The long tendon of bicep brachii and the ascending branch of the anterior circumflex artery lie within this sulcus. The surgical neck is a slight narrowing below both the tubercles. This is very important clinically due to its relationship to two important structures: the axillary nerve and posterior circumflex humeral artery runs around the surgical neck and can get damaged with the fracture of the surgical neck. You can get high marks in Viva by correlating the clinical importance to the anatomy. The axillary nerve supplies two muscles, the deltoid and teres minor. Axillary nerve can cause paralysis of the deltoid muscles, which is the major abductor of the arm. Hence, we will be unable to abduct the arm between 15 to 90 degrees from the vertical position. The middle part is the shaft. It is more circular in upper half and then becomes more triangular in and flattened below the insertion of the coracobrachialis tendon in the lower half. The mid part of the lateral border of the shaft is thickened and forms the deltoid tuberosity for the insertion of the deltoid muscle. The posterior surface has the radial groove for the radial nerve and deep brachial artery. The distal end has an articular part and a non-articular part. The articular part is formed by a medially located trochlea and a laterally located capitulum. The trochlea articulate with the ulna and the capitulum articulate with the head of the radius, forming the elbow joint. Non-articular part consists of two epicondyles on either sides and three fossa. You can earn extra marks by telling that the ulnar nerve runs in the groove on the posterior aspect of the medial epicondyle, which can get damaged during the injury of the medial epicondyle. The olecranon fossa is located superior to the condyle on the posterior aspect of the distal end. The olecranon of the ulna moves into the olecranon fossa during the elbow extension. Coronoid fossa is located superior to the trochlea on the anterior side. During the elbow flexion, The coronoid process of the ulna moves into the coronoid fossa. Lateral to the coronoid fossa and superior to the capitulum in the anterior side of the distal humerus is the radial fossa. The margin of the radial heads moves into the fossa during elbow flexion. Okay guys, best of luck for your future Viva examination.